Good morning, everyone. We'll start in a few minutes. Hey, good morning, everyone. We're gonna go ahead and get started. My name is Gerardo. I'm the founder and CEO of Chartnote. We started in 2020, so 4 years ago, and it all started after publishing a book we call Statnote, and it's still the bestseller on Amazon. So the idea was born to try to help doctors expedite their medical documentation using dot phrases. And one of the feedback that we frequently got was that the doctors wanted to use we use a third-party software that had to be installed on the computer, but a lot of doctors don't have access to admin rights, so they were asking for a web-based solution. So that's how Chartnote was born. And we started with basic dot phrases. We call them snippets, and then we added voice recognition, and just recently we started adding AI, and it's just mind-blowing what we can do with AI. So what we're gonna do today, we're gonna go over the main features, review the mobile app and the Chrome extension, the privacy and security of Chartnote. We're gonna do a few demos, and then share with you some tips and best practices. We'll review the pricing, and then we'll go to a brief Q&A. This might take about a half an hour, and then we can extend it if there are a lot of questions. So you can, at any point, there's a Q&A on the webinar, and Austin will be helping with the questions here. Okay, so let me make this bigger. So Chartnote has 5 main features. First one is the AI Scribe, and what we do with AI Scribe is basically we record the conversation between the doctor and the patient, and we create a note after we get a transcript from the visit. And this is the most popular feature from Chartnote nowadays. But we also released something called Voice Chart. And the idea behind this is that if the patient doesn't want to be recorded, or the doctor just doesn't feel comfortable doing that, Voice Chart is trying to emulate what doctors did 10 years ago before dictation existed. They will see the patient, grab the phone, and then dial a number to record the note, and then a transcriptionist will go over it, structure the note, send it back after a few hours. So now we do this with AI in less than a minute, and that's what we want to replicate here with Voice Chart. And then using AI, we also have Copilot, and the idea of Copilot is basically is ChatGPT in a secure environment, and in the context of your notes. So for example, if you're seeing a patient and writing a note, and maybe you want to know differential diagnosis, or maybe write an after visit summary, anything you can think of, Copilot can help with that. You just have to ask and have a conversation. And then like I said, we started with dot phrases and dictation. The dot phrases, we call them snippets, and we call them because they're basically snippets of text that expand into a template or boilerplate template. So this is just like the dot phrases you see in a lot of EHRs, but if you really have like a bad EHR without those features, Chartnote is the solution for you. And then we have regular dictation, just like Dragon. We have the same level of accuracy. Medical vocabulary is live speech to text. So whatever you're saying, you immediately see it on your screen, or directly in your EHR. If you have a web-based EHR, you can download our our Chrome extension, and the Chrome extension lives in your browser. So if you're using EHR like Athena Health, Practice Fusion, Elation, any of those EHRs, you can install the extension and then dictate insert snippets directly into the EHR. And then we have our mobile app for Android and Apple. And with that, you can do a number of things. You can create notes right there on your phone using dictation, or if you want to type. But also you can use to record your patient visit and use AI Scribe and voice chart. Okay, so the other thing I wanted to say, we're HIPAA compliant, and all the information that it's in our service is encrypted. So if you need a business associate agreement, just reach out and we're happy to sign it with you or with your organization. So let's move on to the demo. Let's see. I'm gonna make this smaller to be able to see the app here. This is my phone. So let me open Chartnote. And this is what you see when you open the app after you log in, and it's gonna emulate what you have on the website. So actually, I don't think you're seeing my. Let's see. Is this connect again? Okay, perfect. So this is my phone, and let me quickly log in here. Okay, and this is what you see when you log into Chartnote. You can create an account for free, and it has all the features that we mentioned earlier, with some limitations. And then we have some plans, and I'll talk about that later. Okay, so on the phone, well, you see in the screen there are the three main buttons. If you want to use voice chart, AI Scribe, or if you just want to create a note from scratch, you click on Note Template. So let's start with AI Scribe, but I'm going to do it from my phone. So you see this blue button on the right lower corner. So that's going to give you these same three options. And what I want to do first is AI Scribe. So this is what you use when you're with a patient. Some tips here. If you're using a phone, make sure you ask for consent. Verbal consent is enough. What I've seen some clinics do is they might put an announcement in the room saying our doctors are using AI Scribe for better documentation. When you're telling the patient, you can say that you're using this app to record a conversation, and then the AI will create a note, and that will give me more time to pay attention to you instead of typing on my computer. The MA can do that when they're rooming the patient, so that's another option. But after you do that, just do a brief documentation to note that you got consent to use the AI Scribe. After that, this is the view of the AI Scribe. We have the note information. Here, you can put basic information like the name, the gender, and the age of the patient. Sometimes this is not discussed during the visit. So for example, I'm gonna put here a 40-year-old male, and let's put the name Austin. Now you can add a patient if you want, and you see this button says assign patient. So if you want, you can click there and create a patient or just assign the patient. But just for simplicity, I'm going to do that. Then you select the template. I use SOAP, and then in this case, office or outpatient. But if you're in the hospital and the ED, you might want to change that. Same thing with the type of visit, if it's initial visit or follow-up. Then you have the option of language, and I'm gonna change it to English here. I'm glad I noticed that, because one of the things that happens sometimes, if you have in a different language and then you record, the transcription will not be recognized, and then you will get some hallucinations from the AI. But we're trying to fix that with some auto language detection. But you can select the language. If you speak Spanish and you're conducting the visit in Spanish, you can select the voice language to Spanish, and then the note is gonna be in English unless you want it in a different language. And then you have the option of billing and miscellaneous. So if you want the AI to suggest ICD-10 codes, CPT codes, EM codes, you can select here or disable it. And that's pretty much it. Then you click start recording, and you start the visit. Now, you don't have to do this every single time. Once you do this, it's going to be saved. I'm going to show you how it looks in the website. And it looks very similar. And so it's up to you whether you want to use the phone or your computer to do a visit with AI Scribe. The benefit of the phone is that it's portable, has a good microphone. If you have a desktop computer in your office, sometimes the internal microphone is not really good. Laptops are a little bit better. If you have a desktop computer, one of the tips that we recommend is using an omnidirectional microphone. Let me show you how that looks. So something like this. It's a USB, you plug it, and then records all the sound in the room. So that's a good option if you're using your desktop computer. If you're using your phone, you don't need anything extra. Use your phone. So let's go start it. And Austin, can you hear me?
Yep, I can hear you.
Excellent. So Austin's gonna be our patient today. So let's hit record. You're gonna see there's a visual feedback of the audio. So that's very important, both in the if you're using the website or in the with your phone. Hey Austin, I'm Dr. Bonilla. How can I help you?
Yes, hi. I've got a issue going on with my right knee.
So you have an issue with your right knee. What's going on with your right knee?
I don't know. I had a ACL reconstructive surgery on it twice, and I don't know. I took the dog for a walk yesterday morning, and when I came back, I was having trouble walking on it, and I did ice it, rice, and 15 minutes later took it off, and I mean, it felt a little better, but I'm definitely having trouble on mobility issues trying to walk around and get around right now. Going up and down stairs is definitely painful.
I see. When was your ACL surgery?
2010, the second one.
So you had it twice in the same knee?
That's correct, yeah.
Okay, so 14 years ago. And when you were walking your dog, any injuries, or it was just a regular walk?
Nothing specific, but I will say he's not the best walker. So sometimes he tends to pull if he sees another dog or, anything like that. I think I might have put a little pressure. He's usually on my right side as well. So
Let's see, what kind of dog do you have?
it's a golden doodle.
I see. Okay. Okay. So, have you noticed any swelling in your knee?
Not really. No. I mean, it's not like swelling as much. It's just painful to walk, particularly downstairs.
I see. Okay. Have you noticed any clicking, or does it get stuck?
No,
No.
nothing of that.
Okay. Well, go ahead and sit over here, and let's take a look. So you have full range of motion. I do feel and can hear actually a little click. Um, so your left knee looks normal. Your right knee is a little bit swollen, not too much, a little bit warm. And let me do this drawer test, and it's negative. And I do feel it's a little bit loose, and you might be the ACL ligament. But what I want to do is um, give you a brace and send you for an X-ray. And are you taking anything for pain?
I am putting on a just to sleep at night. I'm putting on like a topical ibuprofen. I'm not sure the exact thing is called, but just to kind of relieve the pain.
Like Voltaren gel,
Yeah.
something like that. Okay. Does it help?
Doesn't hurt. I think it's helpful to sleep at night, but
Okay.
I
Go ahead. Go ahead.
I was gonna say I don't use it during the day. Other than icing, that's about all I'm doing.
Okay. Well, let's do this. My nurse is gonna give you a new brace. Use that during the day, and
Okay.
then you can continue with the eyes. I'm gonna send ibuprofen 600 milligrams. You can take it twice a day for the next week. And you still using your CVS pharmacy here in Covell?
Yes, that's correct.
Okay, I'll send it there. And then let's do an X-ray just to see if you develop any new arthritis. And I'm gonna give you some exercises to do at home. And then why don't we see you in a couple of weeks? If you're still having pain, maybe we'll send you for an MRI to check your ligaments. But if it goes away, then we will just continue with um, kind of conservative treatment. Does that sound good?
Sounds good, doctor.
Excellent. Any questions?
No, thank you so much.
Okay, perfect. So what I'm gonna do now is hit transcribe, and then after a minute or so, you're gonna see it on your computer. So you saw here it automatically refreshes, and you'll see the note here in the app. You probably want to refresh to see if it's ready. Let's give it a minute. Now, if you don't see this hourglass, you probably want to refresh the browser just to see it. So if we refresh in the app, you're gonna see the note here too. So let's click on it, and let me see if I can zoom in. Okay, so you see it got the 40-year-old male, right knee pain, history of ACL, surgery in 2010. Yesterday, we tried some rise. So it structures it out pretty well. The physical examination, you probably want to speak out loud your findings, and if not, you can always edit your notes. So, for example, you can type. So positive, or you can dictate. So you see this microphone over here. This is the dictation. Positive clicking on right knee period, next line. There's this shortcut you can use to start and stop the microphone with control and down arrow. So you probably want to do some light editing, do some light editing. It gives you an assessment and plan, and it's very accurate to what we discussed. It's suggesting some EM codes and ICD-10 codes. And then what you want to do is transfer this to your EMR. And what most doctors do is they copy paste it to the EHR. So either you see this button here, it says copy note, and you can click there and paste it into EHR. Depending on the EHR, if your text field is just an empty box, you can just copy paste the note. Now, if you have sections, so for example, Practice Fusion, Athena Health, they have sections. So you have to copy the first section, then go to the EMR and paste. And then you do the physical exam. And here I forgot to tell you, you can also insert snippets. So let's see if I can find it. You type the @ symbol and then type a keyword. So I'm going to do knee. Let me see if I find the knee exam here. These are our snippets. They have drop-down menus, optionals. If you want to preview your note, you can see it here. So for example, you see I turn off this section and it's not showing. Anyway, so let's copy this. It's gonna copy just the plain version of this. So I'm gonna either right-click, paste, or Control-V. And then the assessment and plan, same thing, right? So that's how you do the AI scribe. Now let's do the voice chart and the website just for a quick demo. So the voice chart, what you can go home and click here, or on the right upper corner you see this create new note, click voice chart. So it looks very similar. It has similar options, the language, the template. You can add a patient. You can select billing codes, setting, and visit type. And but here you're just gonna dictate. So let's say that the patient didn't want to be recorded, so you saw a patient come out the room. This is a 40-year-old male presenting to the clinic complaining of right knee pain that started a few days ago after walking his dog. He reports having ACL surgery on his right knee 14 years ago. He's been using ice and topical NSAIDs with some relief. On exam, he has some warmth and swelling on the right knee, some crepitus, and assessment plan, right knee pain, history of ACL repair. We'll do circumstantial management with NSAIDs, order an X-ray, follow up in 2 weeks. We'll consider ordering an MRI if symptoms persist. So same thing. And then let me zoom out a little. You're gonna see the note in a few seconds. Now, you have up to 90 minutes of recording time for your visit. So if you are in behavioral health, of your patients with chronic conditions and your visits last longer than an hour, Chartnote can cover that. Okay, so this is a note. You see it's a little bit shorter, but while we're here, I want to show you how we leverage AI to create an after visit summary. So here in the this menu, you see this Copilot tool. So I'm going to click here and click after visit summary. And I'm going to ask for information for the patient. I can select the level. I'm going to say advanced. I can select the language. And then it's gonna create a note that I can copy paste or maybe use print for the patient and use that. Another tool that we have here is rewrite notes. So for example, if you didn't like this note, you can ask for some changes and then the AI will rewrite the note. Now, we also have the Copilot, and I'm gonna start a conversation with Copilot. So in the context of the note, I'm gonna ask to give me some differential diagnosis. So you can ask whatever you want, and it's good to bounce ideas with the AI. Okay, so another tip. So you saw me dictating, and when you're dictating, if you, especially using a desktop computer, if that's the main way you're gonna create notes, I recommend you use an actual USB microphone. It can be this if you're just dictating. It's a USB microphone. I like these kind of microphones that are called gooseneck, because your hands are free to type or move the mouse. But definitely having the microphone close to your mouth improves the accuracy of the dictation. And then if you're using your phone to do an AI scribe, another tip is to put the phone on your chest pocket with the microphone on the top. Usually the microphone is the bottom of the phone, so you put it upside down, and that can help. Or you can just put it in between you and the patient, whatever works for you. Let's see. Now, for the, you see the node that we use here, it has a preset of set of templates that we offered. Let me create a new one. So we offer consult note, ED note, free text, history and physical, something for mental health. But some users prefer to use like a different template. And if you need that, you can create your own template. And actually, you can give the AI custom instructions on how to write the note. So you can learn your style and the sections, the format that you want. So to do that, you go to library, and then you go to the AI Power Notes. And here you can create new templates. So this is what we call the custom AI note templates. And for example, I'm gonna call this my soap for. Here you can select whether you want to use an AI scribe or voice chart or both. By default, both are selected. I'm going to select custom instructions. Let me just zoom in. Here, these are instructions for the note in general. So I'm going to say to write in the style of a family doctor. And then you can add different things. If you want to address the patient by the first name or the last name, or the patient, or all the nuances that you want to add, you can write them here. Here are some ideas. Now let's build a note. So for example, our soap template uses 3 sections: subjective, objective, and then it combines assessment plan. So what I'm going to do here is to put 4 separate sections. Let's say I'm going to add objective, assessment, and plan. Now on the subjective, I could add some subsections. So let's say that I want the past medical history, and then the past surgical history, and then the, let's say, review of systems. Anything you can imagine, you can add. Then we have the custom instructions for this section. So for example, for the subjective, you maybe notice the second node that we created, it had separate lines, and maybe you want a full paragraph and you want it to be more lengthy. So you can say that. So I'm gonna put to format this section as a single comprehensive paragraph without any length restrictions. So I'm gonna write that. Let's say for objective, I want the AI to follow a specific template. So I'm gonna tell it, follow this template, and then adjust depending on the presentation. Let's see. I'm gonna put some brackets. Let's okay, so and then on the assessment plan, maybe I want to include the differentials. And well, actually, I'm going to put that in the plan. And the assessment plan, I want to include ICD-10 codes. Okay, so let's just save this, and this can be as complex as you want. You can use like conditionals. So like if I say this thing, do this, and insert this section, or avoid this section if I didn't mention it during the visit, anything you can imagine. So let's save it, and then let's do a quick, I'm going to do voice chart. Okay, so you need to select your template. So I'm going to select, at the end, you're going to see your custom templates. So I did my soap 4. Okay, so this is a 40-year-old male here for diabetes follow-up. He's taking lisinopril and metformin and aspirin, denies any side effects. His sugars at home are about 160 to 200. He went to see his ophthalmologist a year ago, doesn't have any retinopathy. His past medical history is all significant for hypertension and sleep apnea. His surgical history is relevant for appendectomy in 2010, and review systems denying fever, chills, dizziness, headaches. On exam, he doesn't have any lower extremity edema, normal sensation, no ulcers or skin lesions. Assessment plan, diabetes is well controlled. His last A1C was 6.5. We'll continue with metformin, continue lisinopril, aspirin. We'll send a refill, follow up in 4 months, and we're referring patient to ophthalmology for retinopathy. And And let me pause it. So with this voice chart, you can ramble a little bit. You can go back and forth. And that's one of the benefits versus regular dictation, that you can just kind of think out loud your notes. So let's transcribe. And what I want to show you is if it's following my custom instructions. Okay, so for example, it kind of follow my template. I have the plan. The assessment has the ICD-10 codes. It's not giving me a differential. So you can go back and edit your instructions. If it's not following, you can be can change it a little bit. Okay, so moving on. The last thing I want to show you here is option of creating a note from scratch. So if you don't want to use AI and you just want to use templates and snippets, so here you can, let's do a regular sub note. So it's going to be blank, and then you can type, you can dictate, insert snippets, and you can build your note if that's what you want to do with Chartnote. That's available. You can do the same on the phone. So if you want to dictate on the go, you can go to Note Template, select your template, and then start dictating. Patient is here for diabetes follow-up period. Next line. You can move to the next section, dictate. You can insert snippets of, in the right upper corner, you see this @ symbol. You can search for, let's say, let me see if I have, okay. So you can insert a template here. Dictation also follows voice commands. So on your library snippets, you can assign a voice command, and you can say, let me show you library. Let's go to my library, and let's click edit. A voice command, I can name a command, and then I say insert snippet. Let's say that I call it diabetes exam. So I say insert snippet diabetes exam, and it will insert the snippet. While I'm here, let me just tell you a little bit more about the snippets. So your account comes preloaded with over 1,000 snippets, and then you can create your own snippets in your personal library, but also have a community with thousands and thousands of snippets from everyone in the Chartnote that shares the snippets, and you can import it and then edit it and make it your own. So that's a huge benefit of being part of Chartnote. Next, I want to go over the Chrome extension. So if you on Google just search for Chartnote Chrome extension, and it's the first result, and it's super easy to install. Just click Add to Chrome, and you're gonna see here on the right upper corner where it says extensions in your browser. You wanna click on this push pin to save it and have it accessible here. I'm gonna log in. And now basically I have Chartnote on the browser. So if I have my EHR, web-based EHR, so it doesn't work with Cerner or Epic, I can use the Chrome extension to dictate and insert snippets. So let me open a patient here. Okay, so let's look for a snippet. So I can search here. It's gonna open, if it's plain text, it's just gonna insert the text there. But if it's more complex, has drop-down menus, optionals, you can first edit your note here, and then click insert, and it's gonna insert the snippet here. Now you can do the same if you know the abbreviation. So for example, this one was DM2. The abbreviation is DM2 hashtag. So I'm gonna put here the @ symbol, DM2 hashtag, and then click tab, and it's gonna expand the snippet and insert it into the EHR. So that's how the Chrome extension works. Now you can also dictate, and to do that, if you have a microphone, that's when this kind of microphones come in handy. You turn on the microphone first. So let's go to the extension, and here you want to turn it on, and then I'm gonna turn on the microphone. Patient in no acute distress period. Next line. Oh, sorry. It wants me to allow the microphone. Let's allow the microphone. Okay. General colon patient in no acute distress period. Next line. Okay, so the microphone is acting up, but you can dictate. Let me. You can also, if you don't have a microphone, you can use your phone, the mobile app, as a mobile microphone. So you want to click on this QR code, and then you're gonna go to the app, and let's go to the home screen. And then here you see the QR code in the right upper corner. Click there, and you have two options. You can link with the Chrome extension, which is what we want to do right now. But you can also use it on Chartnote to dictate. So I'm gonna click on the second one. Then you scan the QR code, and now I can use my microphone to dictate. And of course, it's not cooperating right now.
I did have a question whenever you have a chance. I mean, we'll finish this thought first, but yeah.
Let's see. Let me just try it again. Oh, go ahead, Austin.
So going back to the patient note with when you were doing a visit with me, I have by the way, that whole thing is totally true. I injured my right knee, but the question is, so not everyone has a history with knee issues when they come in to see the physician. Do you have a way to give them some kind of plan? Say they don't know about, rest, ice compression, elevate, all that kind of stuff. Is there something that you can give the patient, or have it set up so they can receive an email about, hey, this is a temporary kind of plan until you have your, X-ray or MRI. Right now, you should be doing these things to alleviate the pain.
Yeah, so I think we created a after visit summary. So, and here you can see the history of the Copilot. So let's see. Let's say you want to explain the RISE therapy to your patient. So on the Copilot, I'm gonna just say rewrite these instructions. This patient include RISE therapy. And now you have like a really nice explanation of what RISE therapy is, and you can share with your patient or just print it out. So that's where a Copilot comes in handy. But anyway, let me go back to the Chrome extension. So for some reason, it's not working, but this is how it should work. So you can use the phone to sync with the microphone and then dictate. Moving on. Well, this pretty much is the end. I'm just gonna touch up on what's coming. We're gonna start integrating into e-charts. We're gonna start with Practice Fusion, Athena Health, and Elation. And this will, so you won't have to use the Chrome extension anymore. We first did the Chrome extension, so it's available to any web-based EHR. But obviously, what we want to do with the integration is that, for example, when you create this notes, you can directly push that note into EHR without copy pasting. So the other thing that I wanted to review is the pricing. Let me just open. So we have plans. We have a freemium business model, meaning that you can create a free account and you have access to all these features that I mentioned. Obviously, with some limitations, but it's a free account forever. You don't need to put a credit card. Then we have a premium, professional, and max plan. And depending on your use case, you want to choose one of this. If you just want to use the templates and the snippets, you're probably going to do well with a premium account. You have unlimited use of that. If you want to do more dictation, more like the Dragon dictation style, you probably want a professional account. Now, if you want to leverage the AI, then you want to do the max account, and you have unlimited use of AI, and it's only $99 a month. If you do the yearly plan, you do get a discount, and you get, but you have to pay for the whole year. You can always cancel before 14 days if you're not satisfied with Chartnote. And we have 24/7 support. So if you're in the website or in the platform, on the right lower corner, you're going to see this. You can always chat with our support. We also have a help desk. So if you go to help.chartnote.com, there are some helpful articles that you can read. Then we also have, you see this learn section. We have video tutorials that you can watch and then just follow at your own pace and learn how to do each things. But anyway, other than that, thank you so much for your time, and hope to see you soon. Take care.